and welcome to Coffee and a Conversation with Capital News. I'm Jacqueline Gelano, and I'm joined here today with Dr. Michael Humer, who's running as an unaffiliated independent candidate for the Kelowna Centre riding to be MLA. So before we begin, Dr. Humer, how do you take your coffee?
I take my coffee early and strong.
Perfect. So cheers, first of all, and thank you to Craft 42 for the coffee. Dr. Michael Humer, so you've been a physician for nearly 20 years and now decided to run as a politician to be an MLA, first with BC United, and now you've decided to continue on with your campaign and run as an unaffiliated independent candidate. What is it that motivated you initially to run in this election, and then is it that same motivation that kept you fueled to run as an unaffiliated independent candidate?
Wow, it's been quite the journey, Jacqueline. So I was in practice for 28 years, primarily serving the North and the Interior in the last 21 years at KGH. And I've always been driven with access to service. I came as a thoracic surgeon to Prince George when there was no thoracic surgery in the North, and then subsequently we consolidated in 2001 and continued to serve the Interior, the North, and the Yukon. And I've been motivated for a long time to try to improve systems. And I was behind a lot of significant improvements in healthcare. And I had the pleasure of being the Department of Surgery head for the last 6 years during the pandemic. And I saw that we were doing very well in many things in healthcare, but we were deteriorating in a lot of things, and that healthcare could do better, and I knew I had to step forward to try to help healthcare improve. So I took this journey. I retired specifically a year ago. You can't be a part-time surgeon. And so I stopped doing surgery. I stopped my administrative job to try to bring the lessons I'd learned in healthcare forward at a larger level. And my natural home was the center-right party, and that's what we've been doing. So we were campaigning, going door to door, door knocking, and doing this journey. And then, as you know, things changed dramatically a month ago. And I'm as motivated or even more motivated than ever that I have to continue to do this. So it started out with healthcare. And I'm passionate about things we need to do to help improve healthcare. But as we knocked on the doors, we learned that there are other issues: affordability, cost of living, public safety, addictions, mental health, and also healthcare. And so people desperately wanted change. They wanted to change the government. And as you know, for the last 70 years, if we've ever defeated the NDP, it's been with a center-right coalition. The understanding was that we would then be forming a center-right coalition when BC United apparently got together with the BC Conservatives, but that didn't really happen. And what didn't happen is that it wasn't a center-right coalition. And if you look at candidates up and down the valley, 7 candidates up and down the valley, all well-vetted BC United, former BC United candidates were running good campaigns. None of them were likely even considered. And the trouble with that is then, where was that vote? Where was that central right moderate vote going to go? And so originally I said, I'll let the process play out, but when no calls were answered, no calls were acknowledged, not only me, but my fellow compatriots up and down the valley, I determined that democracy was being troubled. So what was happening, we were having a harder right and a harder left, and there was no center option. And I actually believe the center option is what is most consistent with most people in Kelowna, where we're fiscally responsible, socially responsible, and progressive. And so you asked what got me in was healthcare. What kept me going is the fact that democracy really needs us to do this. And we shouldn't have non-democratic processes that take the vote away from people. A number of people were saying, I'm not going to vote now because there's no home for me to vote. So that's why we're in the race, continuing the race, and really excited to be here.
So a lot of the issues facing people right now really do come back to healthcare and a lack of accessibility, particularly around mental health supports. What would you do if elected to address some of those concerns, or what are the largest concerns with our healthcare system that you've seen, both from the inside and then from the outside as a politician?
So thank you for appreciating that so many of our concerns come back to healthcare. And it's ironic because we spend a lot of money in healthcare. We spend a lot of our GDP in healthcare. Some of the principles I understand totally after 41 years in healthcare, 28 years in practice, is that patients want access to service in a timely manner. My career was spent with large numbers of patients with lung cancer and esophageal cancer, and you achieve clarity at that moment that you want access to services, compassionately delivered in a timely manner, and you want accountability, and you want it to be transparent. But you've rightfully said that so many of our issues are related to healthcare breaking down. And what I would say is that as we have universal access to public education, meaning when you come to town, the school finds a spot for your child, we need universal access to primary care. Because when you come to town, the system needs to find a spot for you. And then if you are in that primary care home with all of its supports, we can do way more proactive preventative work around mental health, around addictions, around all of these processes. So we do a lot of things very well in our healthcare system, but we've gone in a difficult direction. 1 million people don't have access to family doctors. And even if they do, they say, well, I can't really get in, or it's hard to get in. So we need to make authentic, real access to primary care, universal access to primary care.
Fantastic. And thank you for explaining that. So one of the reasons that Kevin Falcon withdrew support from candidates is because of the fear of a vote split. Is running as an independent, unaffiliated candidate in the Kelowna Centre riding, do you fear that could cause a vote split among voters?
It's a fabulous question. And I think Kevin must have assumed that if we were going to form together, we were going to form a center-right coalition. Because as we said, we cannot defeat the NDP without a center-right coalition. So as I've noted, it didn't really happen. So then you get back to the idea of a vote split. And the vote split sort of talks about an engineered type response. And what I would say is that you need to look in each of your ridings and say who is the best candidate. And typically we've said, is it NDP or other, right? And if it's the other, it was typically a center-right coalition. But now that hasn't been formed, we say, okay, well, who's best going to represent our riding, right? Who knows our riding, who has lived in our riding and lives our riding, and also specifically healthcare. You know, I have 41 years in British Columbia, trained in Vancouver, worked in the north and the interior, and know what we need to do for our healthcare system. And part of my passion is that even though it looks like a mammoth task, it isn't that difficult if we focus collectively on accountability, transparency in our systems, and serving the patient. So I would say with regards to the vote split, I was the first candidate in this race, representing a legacy party that likely the majority of the candidates voted for in the last election, right? And again, if there was an authentic effort to come together. And so the challenge I had is that people at the doors were telling me we can't have an NDP government, and I agree. Because the fiscal directions and what that was doing about affordability and what that was doing about for the young people in terms of their opportunity for home ownership and the like, that wasn't working, and it had to be stopped. And not 4 years from now, but now. And then we assumed the Conservatives would expand their tent and form something that could work for the collective of the province. And they didn't do that. And the sadness is that they had that opportunity. But the cool opportunity now is, just as I don't believe the NDP should be given a majority to have 4 years of dictatorial rule, I don't believe the Conservatives should be given a majority to have 4 years of dictatorial rule. And the fascinating alternative in this election, which is unique, You have well-vetted candidates from a centrist party who ran great campaigns, who were likely winning the majority of their campaigns, who now can stop a majority here and a majority there, and they can be that second thought, and they can determine accountability. And the real neat thing is that we've become in this party politics world where you have to answer to the party, right? So if you're in one party, you have to answer to the party, the other party, you have to answer to the party. In this opportunity, the independent affiliated will answer to the constituents. So, you know, it's interesting. Kelowna Centre, it's a new riding, and it's a historic birthplace of free enterprise. W.A.C. Bennett, Bill Bennett, they represented this riding. Even Christy Clark represented this area. So Kelowna now can say, we're not going to let Victoria, Vancouver, or Prince George tell us who we're going to elect. We're going to elect who we think we want to elect in Kelowna.
So you've been, you're about as local as they come in terms of politicians. You've worked in all across the province. What is your favorite thing to do in the fall here in the Kelowna Centre riding? I know you've been up north, you've been in Vancouver. What is it about here that's your favorite thing to do?
I love the Okanagan. I was raised on the coast. A lot of people don't leave the coast. When I met my wife, I had already applied to thoracic surgery, and I wrote that one day I would dream of working in Kelowna as a thoracic surgeon. And we used to holiday in Naramata, and the summer winds would be so beautiful, and they got me to love the Okanagan. Riding my bike, riding my bicycle. Originally it was road biking, then it was a little bit of uphill mountain biking. I didn't want to break anything going down hills. Now it's my gravel bike. And I would say that the rail trail in the fall, stopping for a coffee and something to eat with my family is probably my #1 activity.
It doesn't get much better than that. Well, thank you so much for joining us today, and I really appreciated the opportunity to speak with you.
Thanks for your time.
Thank you.